Hello there, my name is Dr. Ashley Mack. I'm a physical therapist and founder of Hudson River Fitness. Now, yesterday I was working with a woman in her late 50s who fractured her spine after a skiing accident. Now, after a few weeks in a back brace and some movement restrictions, she was finally cleared to get the back brace off and to start physical therapy. Now, I've been working with this woman for about 4 weeks, and I'm proud to say that I've actually helped her go from being so afraid to move to being confident and living without pain and fear. She feels stronger than ever and doesn't plan on stopping her activity. Now, one of the things that she wanted to accomplish within physical therapy and working with me was to be able to successfully carry her laundry from her basement up to the first level of her house without pain, and we were able to accomplish that within 2 weeks. The first step in my resilient low back framework is to address life and how pain affects the function of our life and our well being. And what that does, it's a series of questions and answers that really set the pace of recovery. Now, there are three main stages or phases of recovery. The first stage is called the acute phase. Now, this is within the first 72 hours of injury. And during this time, there's going to be a lot of inflammation due to the tissue or structure being injured or irritated. It's not going to be a death sentence, but it is important to understand that at this time, there's going to be a lot of pain and discomfort. If it's not a medical emergency, moving within the pain-free range of motion, protecting the joint, and managing inflammation is going to be the most important during this phase. After 72 hours, we then move on to the second stage, which is called the subacute phase, which lasts up to 12 weeks. At this time, the tissue is healing. The body is just trying to figure out what to do with the sensations it's feeling. And also at this time, it's important that movement modifications and normalization of just movement patterns occurs before the development of scar tissue and improper movement. Now, by this time, it's relatively safe to move, and with the right tools, you'll be able to recover quickly and return back to the activities that you love. The third phase is called the chronic stage. That's when the pain is lasting more than 12 weeks. Now, not only is there going to be scar tissue formation, but the brain actually gets trained to feel this pain. That means that even though you're healed, if your brain is conditioned to feel this pain, then more often than not, you're going to feel this pain with normal day-to-day activities. You're going to often ask yourself, man, why am I still hurting after all this time? This is where recovery can be a little tricky because the reality is that time really isn't going to help things out at this point. The priority at this stage is to return and normalize function. Now, the first piece of my framework really emphasizes the fact that you do need to identify exactly where you're at in the healing process and understand how your body perceives this pain. Because once you know about your pain and how it's presenting itself to you, you can have control over it. Tomorrow, I'm actually going to share with you one of my favorite stretches for an achy back. Talk to you soon.